Meningitis, a comprehensive overview. So, what is meningitis? Meningitis is an inflammation of the meninges, which are the protective membranes that cover the brain and spinal cord. The condition can be caused by various infectious agents, including bacteria, viruses, fungi, and parasites, or by non-infectious factors such as autoimmune diseases or medications. Types of meningitis. Bacterial meningitis is a severe and potentially life-threatening form of meningitis. It is caused by bacteria such as Streptococcus pneumoniae, also known as pneumococcal meningitis, Neisseria meningitidis, which is meningococcal meningitis, Haemophilus influenzae type B, and Listeria monocytogenes, especially in newborns, pregnant women, and the elderly. This type of meningitis requires immediate antibiotic treatment. Viral meningitis is the most common and less severe type. It's usually caused by enteroviruses, but also by herpes simplex virus, varicella zoster virus, and HIV. Typically, it resolves on its own without specific treatment. Fungal meningitis is less common, but can be serious. It's caused by fungi like Cryptococcus, histoplasma, or coccidioids, and mostly affects people with weakened immune systems, such as HIV/AIDS patients. Parasitic meningitis is rare, but can be deadly. It is caused by parasites such as Naegleria fouleri, a brain-eating amoeba, and is often contracted from contaminated water sources. Non-infectious meningitis can be caused by autoimmune diseases, cancer, certain drugs, or head injuries, and is not contagious. Symptoms of meningitis. Symptoms may appear suddenly or develop over a few days, depending on the cause. Common symptoms in adults and older children include a severe headache, stiff neck, high fever, nausea, and vomiting sensitivity to light, also known as photophobia, seizures, confusion or difficulty concentrating, and sleepiness or difficulty waking up. Symptoms in infants and young children include a high fever, constant crying difficulty, feeding stiffness in the body, a bulging soft spot on the head, known as the fontanelle, and seizures. How meningitis is transmitted. Bacterial and viral meningitis can spread through respiratory droplets like coughing and sneezing. Close contact such as kissing or sharing utensils, or even contaminated food. Fungal meningitis is acquired by inhaling fungal spores from the environment. Parasitic meningitis is often contracted from contaminated water sources. Diagnosis of meningitis. Doctors diagnose meningitis through several methods. A lumbar puncture or spinal tap collects cerebrospinal fluid to test for infection. Blood tests are conducted to check for bacteria or viruses. Imaging, such as a CT scan or MRI, is used to look for swelling or complications. Treatment options. Bacterial meningitis requires immediate antibiotics and sometimes corticosteroids. For viral meningitis, there is no specific treatment. It is managed with rest fluids and pain relief. Fungal meningitis is treated with antifungal medications. Treatment for parasitic meningitis depends on the type of parasite, but the prognosis is often poor. Complications of meningitis. If left untreated, meningitis can cause severe complications, including hearing loss, brain damage, seizures, hydrocephalus, which is fluid buildup in the brain, and even death, especially in cases of bacterial meningitis. Prevention strategies. Vaccination is key, with the meningococcal vaccine, pneumococcal vaccine, and Hib vaccine playing crucial roles. Good hygiene practices like washing hands frequently and avoiding sharing drinks or utensils are essential. Avoiding contaminated water is particularly important for preventing parasitic meningitis. Strengthening the immune system through a healthy diet and lifestyle also helps in prevention. If you found this information helpful, please like, subscribe, and share this video to help others stay informed. Viral meningitis can spread through fecal-oral transmission, such as touching contaminated surfaces, and through respiratory droplets from coughing or sneezing. To diagnose viral meningitis, a lumbar puncture is performed to analyze cerebrospinal fluid, which typically shows fewer white blood cells compared to bacterial cases. Blood tests are also conducted to rule out bacterial infection. Now, in terms of treatment, there's no specific antiviral treatment except for herpes-related cases. Supportive care includes rest and hydration, as well as pain relievers like ibuprofen and acetaminophen. Although complications are rare, severe cases may lead to encephalitis, which is inflammation of the brain. Prevention methods include regular hand washing, avoiding close contact with infected individuals, and vaccinations for diseases like measles, mumps, rubella, and chickenpox. So how does it spread? For Naegleria fowleri, it spreads through swimming in warm, fresh water. For rat lungworm, it spreads by eating raw snails, frogs, or contaminated vegetables. Diagnosis involves CSF analysis, which shows high white blood cells but no bacteria, and brain imaging to check for swelling. Unfortunately, there is no cure for Naegleria fowleri infections, with over 95% fatality. Supportive care includes anti-seizure medications and steroids. Prevention methods include avoiding swimming in warm, stagnant water, using nose plugs in fresh water, and thoroughly cooking food. If you found this information helpful, we warmly invite you to like, subscribe, and share this video to help others stay informed.